Hi, Dr. Kormeili again. So I was doing some mommy and me photos with my daughter and I realized my whole face is sinking down. My eyebrows have gotten really low and there's a little saggedy action happening here in the neck waddle. And I decided to do my Ulthera treatment because, it's been a while since the pregnancy that I could do anything, but this is one of the ones that's really actually safe to do because there's nothing injected, completely non-invasive, and it uses basically the same ultrasound that I used in my pregnancy to be able to cause some heating and tightening in the same areas that a surgeon would go to tighten, except it's completely non-surgical. So most people always ask, like, what is Ulthera? And like I said, it's basically ultrasound being used to tighten the tissue. And we have different levels that we can do depending on what treatment results we want. So we've picked out my treatment results, we've picked out the tip, I'm numbing, we're going to wipe off all this greasy stuff, and I'm going to get started with my treatment. And the treatment usually lasts under an hour depending on how much pain you can tolerate. So I have numbing cream, I've got my pain meds in, and it usually starts out a little warm and they get a little hotter during the treatment. We have a lot of techniques to be able to handle the during treatment slight discomfort. And then afterwards there might be some swelling. Some people with very delicate skin might have a little bit of bruising, but for the most part you're not sensitized to light, there's no cuts, there's no peeling, so it's a pretty easy procedure to recover from. So I'm going to get started on my treatment now.
I'm still doing great. Perfect. So Vanessa, what are the most frequently asked questions by patients during this procedure?
So it's typically pretty much, what am I going to look like afterwards? Am I going to have some swelling? Am I going to be bruised? Will I have any welts? And the answer to all that is yes. I mean, you may potentially get some bruising. It doesn't always happen, but if the patient is on blood thinners or, you've taken maybe ibuprofen a few days prior to the procedure, then your chances are higher. But other than that, bruising is less likely to happen. The other thing would be tiny welts can develop right after the procedure, and it's normal. It's just from the natural, like heat sensation in your body, just it's a natural response that your body takes, so therefore you can get some welts. But they subside within the first maybe a couple of hours to a day or so. The other thing is you may have some pronounced swelling along the jawline. And that is normal. It's just natural inflammation from the procedure, and that can subside within a couple of days or so. And you can, the best thing to do is to sleep with your head elevated for the first night, and that's pretty much it. You don't really have to take any pain medication. You're not going to have any pain afterwards. You may have some soreness, and it's normal. But other than that, everything is pretty, easy and straightforward.
And it's pretty painless from what I'm experiencing.
Good.
And it's very important for patients not to stop any kind of anticoagulation medication. We can work around that, and there are other things we can do to help minimize the swelling or bruising. And if you bruise, we have lasers to fix that too. So now we're working on the lower part of my face for the tightening of this waddle and pulling up the little jowl areas, and then soon I'm going to be working on the eye part. So now that we did the lower face, we're on to doing the eyes, that wider look eye, and lifting the eyebrow and getting rid of some of the sagging in the upper face. So again, it feels kind of like little tiny tickling needles, not very painful, but it's kind of a weird sensation because it feels like there's electricity under it, but it's not. So it's kind of a warm, tickly, prickly sensation. And soon I'll have a little bit more swelling there, and we can do it before or after. It's a very interesting sensation over bone because the ultrasound conducts differently over bone than tissue. So it kind of stings a bit more, and this is the reason we do a lot of numbing and give numbing medication for this. But as you can see, it's tolerable enough that I could talk to you, so not horrible by any means. And now we're on to the neck. Pretty much the same sensation, but actually a lot less pain. Probably the most painful part is on top of the eyebrow because it feels like an intense headache. So now we're getting rid of the wobble of the neck. All done with my treatment. I have a patient waiting for me next door time to go see the patient. So that was fun.